The ASHP Research and Education Foundation, in partnership with the Cardinal Health Foundation, is proud to introduce the finalist and recipient of the 2006 Award for Excellence in Medication Use Safety. No other award recognizes the critical leadership role that pharmacists play in affecting organizational improvements for medication use systems in hospitals and health systems across this country. The first of our two finalists is McLeod Regional Medical Center, located in Florence, South Carolina. In 2001, McLeod had a rate of harm of 35 patients per day, a punitive error reporting system, an antiquated pharmacy, and no clinical pharmacy services. McLeod launched its pharmacy management project with one purpose in mind: to reduce medication errors. Headed by the Director of Pharmacy, the project involved physicians, pharmacists, nurses, and administrators in the planning and implementation of a redesigned medication safety process. The new process includes a progressive pharmacy service, a non-punitive and confidential error reporting system, electronic medication administration records, and a medication safety educational program. The results were impressive. The rate of harmful events decreased by 90%, the number of steps to administer medications dropped from 17 to 5, and the medication turnaround time decreased from 1 hour and 45 minutes to approximately 7 minutes. McLeod's pharmacy staff is now 100% decentralized, making them more accessible to nurses, physicians, and patients. This project is a fantastic example for our profession. Congratulations on your achievements. The second of our two finalists is St. Joseph's Candler Health System, located in Savannah, Georgia. In 2000, a multidisciplinary team at St. Joseph's Candler conducted a medication safety self-assessment and discovered a need to improve the IV medication administration process. Internal evidence showed that IV errors were contributing to adverse patient outcomes. The organization formed a team of physicians, pharmacists, nurses, and administrators to improve medication safety. The team chose to implement smart infusion technology in every patient care area. They also established infusion safety goals and a staff education program that included computer-based and hands-on training. Improvement in the safety of IV medication administration at St. Joseph's Candler has been significant. The new system has prevented IV medication errors with a high potential for harm, as well as adverse outcomes for respiratory depression. In the first 9 months of use, the new system issued 521 alerts that resulted in changed or canceled infusions, averting significant medication overdoses. As an early adopter of smart IV technology, St. Joseph's Candler has become a model for other institutions looking to implement similar systems. Congratulations on your achievements. And now, let's meet the recipient of the 2006 Award for Excellence in Medication Use Safety. The Alaska Native Medical Center's South Central Foundation telepharmacy program sought to improve pharmaceutical care to its patient population. Spread out over a nearly 2,000-mile area, where only 21 of the 52 communities in this region are connected to the road system, transportation is often dependent on planes, boats, and good weather.
I think looking back on it, we had two different standards of care for patients. If you lived in the Anchorage area and on the road system, you could come here and get the full service, have a pharmacist take care of you. If you lived out in the villages, you had to do without that. And when I first learned about telepharmacy, I thought, here's a perfect opportunity to even up the playing field so that whether or not you lived in Anchorage or on the road system, you got the exact same level of care.
When the pharmacy group brought this idea to us, we embraced it because it was collaborative. It involved many people that within our service unit, within the Native community, and also with foundations and groups.
So this project required the coming together of dozens of rural tribal leaders, the leadership of the two corporations here, and the management at the Alaska Native Medical Center. And then because of the expense, we had to bring together many different funding partners as well. So this has been a real impressive project of crossing boundaries, crossing areas of responsibility, risk, and liability, and bringing together a whole system around a project that in the end has made life better, more efficient, and safer for those receiving services from our system.
That's our main role, our largest impact that we've had is just allowing the pharmacist to be available in these small rural locations where FTEs or full-time positions are difficult to justify, and recruit and retain professionals out in the village.
The Alaska Native Medical Center team demonstrated that with its telepharmacy model, it is possible to provide high-quality pharmaceutical care across distances to isolated communities despite transportation limitations and frequent power outages.
There is a solution now for serving rural, underserved populations and providing pharmaceutical care in real time. And we would be more than happy to talk anyone through how we did it, the important steps, because we know that there's hundreds, if not thousands, of locations in the lower 48 that could use this very type of system.
Alaska Native people have a very long and rich history of storytelling. A great deal of how we learn is from hearing other people's stories and then incorporating elements into our story. So this particular piece, the telepharmacy piece, will just be another piece of our story, another story we can tell to others that they may find some use in, that hopefully will help them implement similar processes more quickly, more efficiently with less problems than we had, since we were one of the first to do this.